Welcome back to MSNBC special coverage of the fight against coronavirus. According to the National Institute of Mental Health, nearly 1 in 5 adults in the U.S. lives with mental illness. That's more than 46 million people. About 42% of them receive mental health services. According to the National Survey on Drug Use and Health, more than 19 million American adults battle substance abuse, and more than 8 million suffer from both a mental health disorder and substance abuse.
Coronavirus can take its toll regardless of whether one has a diagnosed condition. But with cases rising and people taking more precautions, it can be harder to cope, especially if this is disrupting your daily routine or your mental health resources.
Joining us now is the former president of the American Psychiatric Association, Dr. Jeffrey Lieberman. I think these are some of the most numerous questions we get, so let's just jump right into them. I'm having difficulty handling the separation from my husband, who was in the hospital with double pneumonia when it was locked down to visitors. I understand and agree with the situation, but the patients are depressed at not seeing their loved ones, and we feel powerless without the ability to be with them. I know the nurses and doctors are stressed out under these conditions and doing their best. Do you have any advice for family members who are on the outside?
Well, isolation is important for the purpose of containing the spread of the virus in hospitals, nursing homes, and other places that have people who are at high risk are taking those precautions appropriately. Isolation at the same time is a byproduct of it, and that's problematic because it compounds the problem for not just the patient, but also from their family. So for the wife who was asking, one thing would be to see if you can communicate with them virtually. In other words, call by the phone, ask a nurse or an aide or some healthcare provider if they can go in the room with a phone or with an iPad or FaceTime and to speak to her husband and to maintain as much contact as you can. If her husband is able to communicate via a text messaging or by FaceTime themselves, if they're allowed to have a cell phone, then you should use that. Virtual technology is being utilized in enormous ways that it hadn't before, and it'll probably set a precedent for the future.
Can we just clarify something in the question? The person who wrote the question said the patients are depressed at not seeing their loved ones. Can we just be clear? There's a difference between being depressed and having clinical depression. Just because you're depressed doesn't mean that it's a diagnosable condition, and it certainly doesn't mean there's something wrong with you.
Thank you, Joshua. That's like the nomenclature, unfortunately, for clinical major depressive disorder, and just the common term of sadness to being depressed is a very confusing one. But you're exactly right. If you're in the hospital, it's not a happy thing to begin with. But then if it's compounded by the isolation, then your spirits are going to be down. But that doesn't mean that you have a mood disorder and that you're clinically depressed. Nevertheless, it's something that can be helped, and having some ability to communicate with family, loved ones, friends, as opposed to sort of sitting there by yourself with your own symptoms, only dealing with the hospital staff, that can be depressing. And the hospitals are trying to do something, but frankly, although everybody is under stress now, the healthcare providers in the front line are really on the spot.
I was wondering if you have any tips for college university students that have transitioned to online schooling. How do we improve our mental health and stick to a schedule while staying inside?
Well, I think, Chris, the way I would frame it is that, oh, I touched my face.
You're allowed one. You cashed it in.
Is that there's different buckets of the population that people fit into in terms of their risk and in terms of the way they're psychologically going to react to this. First, you have the worried well, who most students would be members of. Then you have individuals that have milder or less severe mental disorders, anxiety, depression, obsessive-compulsive, phobic disorders, substance abuse, and then you have the really severe psychotic disorders, and then you have individuals who are in those high-risk groups for complications of coronavirus, the elderly, people with immunocompromised conditions. But for the worried well, which is most college students, they have to first try and frame this phenomenon, which is unprecedented, and allow themselves to take some control. In other words, it's bad, but it's not necessarily going to kill you. We will recover. Other countries already have passed through it, so that time needs to be adapted to use most productively. And all universities are shutting down, so all students are going to have this problem.
I'm glad you mentioned the worried well, because that gets to a very sad question we got from a parent. And the parent asked, "My child is so scared that she won't sleep in her bed because she thinks she is going to die. I have tried to talk to her, she's 9 years old, to calm her, but I'm not doing such a good job. Please help.
Let her sleep with you. She can sleep in the same room.
Are there words, are there phrases, are there ways to, I know it's very different from a 4-year-old to a 9-year-old to a 16-year-old, but what's the basic message we should try to convey to kids?
This is something we've never experienced, but it's something that we're going to get through, and everything will be normal. The only thing that won't come back is death. If people die, they're not going to come back. So that's the thing we have to prevent. But I would say to I have to say it to my family members, not just young children, is that this is something which you should be nervous about, because nobody's ever experienced anything that has had this pervasive an effect. But there are aspects of it that should be reassuring. It's not Ebola, it's not small, and we're going to get through it. And you are somebody who is not necessarily going to be severely at risk in terms of medical danger or physical danger, but we do have to adapt. And you have a responsibility as an American citizen to first take care of yourself, but then you have to take care of your family and other citizens as well.
And briefly, before we move on, I know that we're trying to keep the hospital system clear for people who have acute symptoms of coronavirus and so forth, but at what point would you recommend people seek some kind of help from a mental health counselor, a psychologist, a psychiatrist, if they're doing all of these things, employing all these strategies, and it doesn't seem to be making a difference? How do we know when to raise our hand and say, I actually need some other kind of help?
Joshua, I think did you have some psychiatric training?
No, but I mentioned this last week, I've been treated for anxiety and depression before. So I'm kind of wondering, because I've been through it, at what point do you ask for help?
So the medical authorities are saying if you're sick, don't come in. Stay away. Call your primary care provider, and only if you're on death's door, really severe, come in, because they're going to get overwhelmed. With mental health care, it's the opposite. So the worried well can handle most things or don't have pre-existing conditions, and the first thing they try are techniques of mental health first aid. Don't catastrophize. Do not watch the media 24/7, because these stories are going to be on. Try and distract yourself with activities. Reframe. But if it gets too much, or if you do have a pre-existing condition, you'll probably have an exacerbation of symptoms, which will warrant an increase in treatment, whether it's medication or increased contact with your doctor or therapist. And you should be able to contact. If you call your doctor and they don't take your call, you get another doctor.
Dr. Jeffrey Lieberman, former president of the American Psychiatric Association. Doctor, thanks very much.